As our last piece of innovation that we're going to talk about today, it's a great story from Nepean Neonatal Intensive Care Unit on using probiotics, friendly bacteria, to save tiny lives. When I was a pediatrician, or training to be a pediatrician in neonatology, we were terrified of necrotizing enterocolitis. It's a horrible condition which, if the child survives, can often survive with extreme disability and difficult to provide nutrition. So anything that helps this is enormously beneficial. And to talk about this innovation is a neonatologist from Nepean, Girish Deshpande. Thanks, Girish.
Just want to say first, thank you for giving us the opportunity to present our intervention from the small Nepean Hospital and an NBM LHT. So probably all of you know what probiotics are, but this is the official scientific definition of probiotics, and they're defined as viable microbial food supplements, which when taken in the right dose should beneficially influence the health of the host. And the reason why we talk about probiotics in our little preterm neonates is because of this very serious and potentially deadly condition known as necrotizing enterocolitis. Norman, I just mentioned about NEC, and this is actually one of the commonest GI emergency of unknown cause. I mean, scientists are studying this condition for almost last 30 and 40 years, but we still don't have any answer why it occurs and what should we do. The incidence of NEC is more or less same for last 25 to 30 years. About 4 to 5% of the babies born less than 32 weeks, that's roughly 2 months early, get this condition. And the incidence is quite high in small babies, about 8 to 10% were born at least 3 months early or less than 28 weeks. Currently, no matter what we do, about 20 to 40% of the babies do die of this condition, and the mortality is quite high in smaller babies, about less than a kilo. Now, on the left side of the slide, you're looking at a figure of a baby, and the condition strikes without notice. Typically, we're looking at a baby who is born prematurely, somewhere between 3 weeks to 6 weeks of life. Suddenly, you will find the abdomen or tummy is distended. The baby is not tolerating feeds, potentially deteriorates very quickly, and then there are only 2 options. Number 1 is surgery, or just treat conservatively if surgery is not indicated or not option. If you do end up getting a surgery, then the slide below, you're looking at the gangrene of the bowel. So potentially you might need to remove a part of the bowel, sometimes much larger part of the bowel, where the baby may end up with short gut syndrome. If the baby is lucky to survive, it's not over yet, because then in long-term wise, we are looking at problems in terms of development. Significantly number of babies can get cerebral palsy, and then it's a very expensive condition to treat. For a not so severe necrotizing enterocolitis, the hospital stay will be long, and you're looking at roughly $100,000 for that baby. If the condition is quite serious, you're looking at roughly $250,000, particularly if that requires surgery. Now, I don't have the data for Australia, but it's estimated that in America, they spend roughly $1 billion per year for this particular condition. It's pretty expensive. As I mentioned, we don't know actually what exactly the cause of this condition. But the most appropriate hypothesis talks about inappropriate GI colonization. And this is simply because we got really small premature babies who stay in an ICU for a long time. Their gut is premature, so we can't feed them for some time. They stay in an ICU in hostile atmosphere. They get exposed to lots of bad bugs. Then on top of that, we give them antibiotics, and they get infection. So they have absolutely no chance to develop a normal GI flora. Now, our group is doing probiotic research for a long time, and this is my topic of PhD. The first paper we published was in Lancet in 2007, and that particular paper actually just highlighted the possible benefits of probiotics. But not until 2010, when our paper got published in Pediatrics, the benefits were confirmed in roughly 2,500 babies. And then at that time, we decided to recommend probiotics as a routine therapy for prevention of NEC. Now, I'm not going to talk about all the theory, but one of the common mechanisms by which probiotics work is simply by providing appropriate bacterial colonization. Of course, they could improve the gut motility, or they could also improve the gut barrier function, and there are all those other scientific terms they can do. In this debate, we just heard that there are so many innovations proposed, but not all innovations make it to the practice. But our group was determined to push this innovation into practice and implement a stepwise plan to introduce routine probiotics for prevention of NEC. And then after introducing the probiotics, our plan was to collect the data prospectively and compare the key outcomes with retrospective cohort of our own hospital, which did not receive probiotics. But there were huge practical issues of getting a probiotics. The first, foremost important was the probiotic product availability. If you go to the pharmacy, there are a number of products available, but which products we should use in our small preterm babies, it was highly unclear. Plus, there is the issue of regulation. When you talk to Therapeutic Good Administration of Australia or TGA Australia, they're quite strict about things what we should give to our baby. So how should we classify probiotics, a food or a drug? Technically, it should be a food, but by definition of TGA, if you're using it to prevent one particular condition, then it's a drug. Then it's a question of suitability, the quality control, safety, and the protocol as well. This particular number of probiotics were available in 2010. So when we actually went to the market, there were capsules available, suitable for adults. Then on the right side, probably you know the Yakult, which probably you see in supermarket. Can't use it for the babies. Then if you see below, there are lots of products available in terms of sodas, powders, again not suitable for the babies. On the left side, you're looking at which looks like a bottle of red wine. That's actually labeled as ginger olive oil probiotic punch. Supposed to be useful in men for prevention of prostate-related problems. And again, you can't use anything for us baby as well. So we decided to go on a stepwise approach. First step was to develop evidence-based guidelines to use probiotics, then to identify a suitable probiotic product. We searched locally, we couldn't find any, that's why we imported one from overseas. Then to follow TGA guidelines to get approval from local drug and therapeutics committee. Then get an endorsement from local ethics committee as per TGA rules. And then we prepared a parent information sheet because we were actually first one to introduce this intervention so parents can make informed decision. Then of course the final application to TGA. Then we realized after getting all approval that you can't just import the probiotics because our quarantine and customs will probably confiscate it. Because probiotics are classified as live organisms and there are some other live organisms like botulism and anthrax you don't want in our country. So we need approval as well. After getting that probiotic, I'm not going to trust that probiotic just blindly, so we did some independent quality assessment of the product. Then we developed our own practical protocol for use, and then we performed our prospective audit. These were our paper about guideline, which tells them about what we should use, what doses, which probiotics should we use. There were lots of departments involved, particularly pharmacy, infection control committee, our microbiology department. We did lots of educational sessions, and the cost of probiotics was really cheap, about $30 to $60. And that cost was covered by our Nepean neonatal intensive care parent support group. And these are basically the parents who had preterm babies in NICU, and they did the fundraising for us. So what they did actually a 12-hour fitness challenge. So in the left picture, you're seeing my colleague, Dr. Vijay, and these are all the parents. We also got one preterm baby who is 18-year-old in this fitness challenge, and then there is $8,000 for us. This is how we give probiotics. So we mix the probiotics into breast milk or formula, depending on parents' choice, and then we feed them with a feeding tube. This is our data. So on the left side of the column, these are the probiotics babies. On the right side are the retrospective controls. And we have seen significant reduction of necrotizing enterocolitis, almost down to 0% compared to 5% previously. There were also some other benefits in terms of time to full feeds. So babies who received probiotics tolerated feeds quite well. So we saved on total parenteral nutrition. And we're also seeing some early benefit in terms of reduction of sepsis, which we will monitor. Currently, we are spreading the message. Our papers have already published and some are under publication. We organized 2 workshops in our Pisans meeting, and we also had significant media coverage in terms of ABC News, newspapers, and magazines. Currently, we are supporting many neonatal units in Australia. Roughly about 11 to 12 units are already using it or working towards using it. We are currently in the process of writing a statement for New South Wales Health for using routine probiotics. We are also going internationally. So currently, Nepean Hospital is supporting various neonatal units in New Zealand, Singapore, America, Ireland, Netherlands, and also in developing countries like India and Thailand. There will be significant impact on healthcare. The possible cost saving, and assuming only 50% reduction of NEC, will be close to $10 to $15 million in Australia, and could be in billions if these probiotics are used worldwide. And as I mentioned again, the cost is really small, $30 to $60, and it's just not about the money at the end of the day. It's difficult to put any cost for the emotional trauma of the parents with a child who had a cerebral palsy after suffering from severe NEC. This is our group at Nepean Hospital, my medical colleagues and the nursing staff. And I'll leave you with a slide of our first baby who completed the probiotics therapy, was born at 26 weeks. She's here actually, we'll meet her soon. And I'd like to acknowledge our parent support group and our AUSVAC group for their funding. Thank you.
We have two mothers and one baby to talk about their experience of probiotics and the Nepean NICU. Could you please welcome Jessica Parsi and Sherry Huxley, and Madison. How old is Madison now?
She's 20 months old.
Tell us the story.
Well, she stopped growing, and when she was born at 28 weeks, she was born at 660 grams, and that was because I had clotting in the placenta. So that's why she stopped growing originally. And then we went for an ultrasound and we found out that she'd stopped growing, so they did an emergency cesarean, and the next day we had a baby. So we weren't expecting her for another 3 months, but yeah, here she is.
She came early.
Yeah.
And Sherry, your story with Ezekiel?
Well, we found out that he wasn't growing. He was being monitored while he was in utero for a while, and then I spent about 3 weeks in hospital just so that they could monitor him via an ultrasound a couple of times a week. And then after he stopped growing completely and his flows reversed, we had an emergency Caesar. He was born at 580 grams, and he had a whole lot of other medical conditions as well.
Such as?
Well, he had a valve that needed to be closed in his heart that was still open. He was at high risk of bowel perforation. There was a whole lot of things actually.
Highly dramatic.
Huge. Yeah.
And you must have been in pieces just in terms of the anxiety of it all.
It was difficult, but we had a really, really supportive team at the NICU unit. They kept us updated every step of the way. There was nothing that we weren't, kept abreast of, and they were very informative and very helpful there.
And Jessica, how stormy was Madison's early days?
Sorry?
How stormy were Madison's early days?
Yeah, very, very scary. I didn't see her for the first few hours, and then when we finally got to see her, my husband told me that she was really small, and when I went into the room and saw her, and saw her,
Never work with children, is the...
Yeah, and when I went in to see her, it was just unbelievable, and with the support from the NICU unit, nurses, doctors, everybody that was there, and family, it made it a lot easier experience.
So did either of you have any idea at all you think of respiratory problems, maybe heart problems with a newborn baby. Had you any idea at all of this potentially dangerous bowel problem?
Prior to Zeke being born, I wasn't aware of it at all. I was warned before he was born that he would have extensive health problems. Like, he's only just come off daytime oxygen yesterday.
Oh, really? Congratulations.
So he's on nighttime
That's
oxygen.
great.
That's very exciting.
Great.
Yes. that
Bronchopulmonary
oxygen
dysplasia
defeated.
defeated.
Around the house.
Yes.
Yeah. But we weren't aware of NEC as a problem until we were told about it after he was born. And then it actually was quite scary considering the risks that are associated with that.
And were you aware of it at all?
No, I had no idea, and we didn't even know that she was any risk of anything, until the Monday, and then the Tuesday she was born, and it was such a blur. I honestly, look back on it now, and there's still information that I missed at the time.
So what did you both think when somebody came to you and say, would you like to try you on this trial for probiotics?
It was a no-brainer. It was absolutely a no-brainer. This product doesn't have any side effects, known side effects, and it could prevent this potentially fatal condition. Yes, please give my child the probiotics, please. Yes.
Jessica?
It was quite scary knowing that Madison was the first baby.
Oh, she was the first. I didn't realise that.
Yeah, she was the first baby to trial it. So it was quite scary initially, but then with the information that we were provided and the statistics and stuff that we were provided.
I know where this is going now.
My husband and I went away with the information, and yeah, like Cherie said, it was a no-brainer once we sort of got over the initial thought of it being a project as such, and then, yeah, the benefits far outweighed having NEC.
So when you see Girish's presentation of the data, you know, the results, it must be incredibly, I mean, you see it for your own children, but incredibly gratifying.
Yeah.
0% mortality since they started using it, yes, extremely, yeah.
Do you have any reflection on, because we were talking a little bit earlier today about experimentation being part of innovation, but do you have any reflection for other parents, patients who might be invited to participate in what essentially is an experiment based on your experience?
All I would say is, you know, if you're given the information, and like Cherie said, there was no side effects or anything like
It's
that.
not potentially harmful.
That's right, and if you consider that, you know, your baby could get a harmful disease, or anyone could get a harmful disease if you don't do it, and to what we have today, both Cherie and I, it's unbelievable. So
Yeah.
No, it is fantastic. And just a final couple of questions to you, Girish. How did you know, I mean, breast milk has bacteria in it.
Yep.
How did you know what bacteria to put in? Because you've got all sorts of stuff being sold and probiotics. And how did you know the cocktail to use?
Yeah, I mean, that's why we developed those evidence-based guidelines, actually. So even at the end of 2010 paper, we were not quite sure what probiotics should be used, so we reviewed all the literature. And then based on the data for about 4,300 babies, we came to a conclusion that you need a combination of Lactobacillus acidophilus and one bifidobacterium. And then we looked at all the products and found this one, which was already tested in about 400 babies and was quite safe.
And did you test it for being alive before you gave it? How did you know?
Yes, we did that actually, because I wasn't just going at the brand value and looking at the label. I want to make sure that it contained the same bacteria as what it says on the label. So we did some testing in our university lab before we actually introduced it. So we confirmed the species, confirmed the colony count, aliability, and then we decided to use it.
And do you have local manufacturers making it now?
Sorry?
Do we still have to import it, or do you have local manufacturers who've picked up on this and are producing it?
At this stage, I mean, there is no local manufacturer at this stage who are picking it up, probably because the cost of registering that product with TGA is quite high, about $300,000. And simply, I mean, being a neonatology, although it's very interesting branch, but there are not many babies in Australia. So I think it's still an open issue at this stage.
So it's
still importing.
Compassionate access.
Yep.
Could you please thank Jessica, Cherie, Madison, and Girish? Thanks very much. I will not hand the comforter back to Madison since it's been on the floor.
thank you.
Thank you very much indeed.